Hello everyone, welcome back to Parently. This is Dr. Boyd. We're talking about a very important subject today, postpartum depression. Now, I'm going to subgroup this into postpartum blues and postpartum depression. Blues is quite common. Depression actually is quite common as well, but it's much more severe. So let's break this down into who will experience this, why they're going to experience this, when they're going to experience this, and what to do when you do experience this. So postpartum is a time that all women will experience. At some point, you're going to deliver your baby either by vaginal delivery or by cesarean section. When the completion of the pregnancy is over, the hormones in the brain, specifically estrogen and progesterone, fall dramatically. Throughout your pregnancy, they've been elevated, and after delivery, within 3 days, they fall dramatically back to their pre-pregnant levels. It is these hormones that cause postpartum blues and potentially postpartum depression. When these fall to their pre-pregnant status, your body dramatically changes and you start feeling these effects. What do you feel? You feel a feeling of sadness. It's hard to understand. Several days ago, you were elated that your baby was here. Now we're 3 or 4 days after delivery, and you're feeling sad. You're potentially feeling like I'm overwhelmed. And those are very, very normal. Typically, these resolve within about 1 to 3 weeks. They typically can get worse, but most women experience blues that go away by your 3rd week. Now, what to do for these? Well, it's important that you have help. That's the key ingredient. You need help either from your spouse, from a mother-in-law, from a friend. Oftentimes, this will help alleviate those symptoms. However, it's important to understand if you had a traumatic delivery, or if you had trauma through your pregnancy, or if you're under high stress from your husband not working or from bills that are dramatic, those can all stimulate postpartum blues to become worse. Now, after you've been out several weeks, you should start feeling better. This is the end of the blues. Now, if you continue to get worse, you have helplessness, you have trouble sleeping, you can't eat, you're up all kinds of during the night, those are a signal potentially that you have postpartum depression. This is a dramatic problem. It can affect up to 1 in 7 women. So not being prepared for it is problematic. So it's important to be potentially open to the fact that you could be one of these women that experience postpartum depression. Now, I mentioned stress. Stress is very key to this, and alleviating stress oftentimes simply has to do with getting help at home. Again, I mentioned having your spouse or your mother or your mother-in-law or a friend come in and help you so that you don't have those feelings of severe stress. Very important that you get up in the morning and get dressed, take a shower, clean your house, feel like you're in control of the situation instead of the situation taking control of you. Now, if you feel like you're getting worse, it's important that you discuss this with your spouse and that you see your healthcare provider immediately. Don't wait. So if you were to call the office and they say, well, we will get you in at your 6-week postpartum visit, you need to be proactive and say, no, I need to be seen now. I feel like I have postpartum depression. When you get to your healthcare provider, you need to explain to them how you're feeling, what you're going through, and hopefully, if you're experiencing postpartum depression, that diagnosis will be made immediately. It's important to understand that after you get diagnosed with postpartum depression, that you have a twofold approach to treatment, an antidepressant and counseling. Both of these need to be carried out. Now, sometimes women are very resistant to antidepressant medication, but universally, this is the treatment of choice with counseling when your postpartum depression is diagnosed. Now, people ask, how long will this last? That's a variable that nobody knows. Sometimes it can last several months. Sometimes it can last forever. In other words, some women go on postpartum depression medication after they get diagnosed with postpartum depression and are on that medication the rest of their lives. It's also important to understand when you're considering your diagnosis of postpartum depression that you look back proactively and ask your parents, specifically your mother or your grandmother, did you suffer from depression after delivery? Did this last for a long time? Ask your sisters if they had the same problem. And then look at your own clinical history. If you have a history of depression and you've been medicated in the past, you're at increased risk for having postpartum depression. It's important that you talk to your healthcare provider. Sometimes we recommend that you start your medication, if you're not already on medication, before delivery. Sometimes we start the medication at around your 36-week pregnancy mark and continue that through the end of your pregnancy and even increase it during your postpartum period. Those are important topics that you need to discuss with your healthcare provider. Now, I don't want to be negative here because it's all about being positive, but you have to understand that this is a severe disease that can lead to an emergency called postpartum psychosis. Now, this is quite rare. In my 25-year career, I've only seen this happen a couple times, but basically this is when you lose touch with reality. There is a certain subgroup of women that undergo postpartum depression that subsequently undergo postpartum psychosis. It's small, but you need to be prepared for that. And this would be a video that I would encourage you to watch with your spouse and your family, especially if you have a family history or a personal history of depression. I hope this was helpful today. Again, a difficult topic, but be proactive. This will decrease your long-term effects that are negative. Have a good day.